I'm Dr. Ryan Rebowe. I practice in Mobile, Alabama. I'm part of the Park Clinic for Plastic and Reconstructive Surgery, and we specialize in all kinds of plastic surgery, including cosmetic and reconstructive surgery of the breast, body, face, and extremities. And so we really encompass pretty much every aspect of plastic surgery here at the Park Clinic. I think that women choose our practice for two reasons, really. And I think that is experience and expertise. Both Dr. Park and I are board certified plastic surgeons, which is a very rigorous process. We both trained at what I feel like is one of the best programs in the country. We did a lot of cases in training, and we do a lot of cases in practice. And we stay very busy with all different kinds of reconstructive and cosmetic surgeries, which really, I feel like gives us the best of both worlds and allow us to apply a unique approach to every patient and give them really what is best for them. When a woman comes in for breast augmentation, the first and primary thing is to get her goals. I utilize a patient's measurements to determine the exact implant that will make her happy based on her goals. It is not about just what the woman wants or what I want or what I think. It's actually about the characteristics of her breast and the soft tissue measurements that I will take in clinic, and then finding an implant that will fit those soft tissue characteristics based on her goals. And so, again, it's not a random guess. It's not just picking a size or a cc or a cup size. It's really more about giving you the exact look that you want. I do think that is where the IDEAL implant kind of fits into the equation, where it gives you more of a silicone look and feel, but with a saline implant, which can address some of the concerns that some women do have with the silicone implants. But I would say, again, choosing an implant is not just trying on a sizer or filling your bra with a bag of rice at home. Choosing an implant is really getting your soft tissue characteristics, getting your measurements, talking with your surgeon about what your goals are, and then picking the appropriate implant for you. It is very common that a woman comes in with concerns of some type of rupture of either a silicone or a saline implant. And, obviously, if it's a saline implant, that rupture looks a lot different than a silicone implant. So if it is a saline rupture, you will notice an obvious difference. It can be a little bit harder to tell a silicone rupture. What I usually will tell women is that silicone ruptures can be more difficult to tell, but they are rarely truly silent. You will typically notice some sort of hardening of the capsule, maybe a little pain or a twinge here and there. Notice your breast looking just very slightly different. And at that point, it's good to go see a board certified plastic surgeon who can examine you and recommend where to go from there. For IDEAL, I do feel like it gives us a very niche product, something that feels like silicone, but is not silicone, that again, it can decrease some of the concerns around silicone implants and rupture and make women feel more comfortable and confident in what we're putting in their bodies. And so in that way, I really do feel like IDEAL Implant has an advantage in that respect, over a traditional saline implant, because you're really going down on, cutting down rather on a lot of the problems that you see with a traditional saline implant, and cutting down a lot of the concerns that you have with a traditional silicone implant. People often ask me why I chose to be a plastic surgeon. What is the best thing about your job? And I will just honestly say, and my honest answer is always, I just think it is the coolest job you could possibly do. I mean, I think all the different surgeries we do are really just fascinating. It's fascinating anatomy. And the main thing is that it's really awesome to be able to work with our patients towards a goal and help them achieve that goal. And I just feel like it's the best job in the world.